Welcome! My name is Dr. Erica Ibendale. I am a bariatric and general surgeon with SSM Health, Illinois. I appreciate you taking the time to listen to the options available to help you begin a journey to a healthier new life. I will provide you with an overview of our program, the services provided, and insight into helping you make the best decision for you. First, let me start off by telling you about myself. After medical school, I completed my general surgery residency at the University of Missouri Hospitals and Clinics in Columbia, Missouri. I then went on to complete my bariatric surgery fellowship at Menorah Medical Center in Overland Park, Kansas. Our weight management program is offered at 2 locations, St. Mary's Hospital in Centralia and Good Samaritan Hospital in Mount Vernon. Both locations are equipped to accommodate your needs, and our staff is specially trained in caring for our bariatric surgery patients. Both locations have been accredited by the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program. We have recently earned the Blue Cross Blue Shield distinction. We offer a comprehensive weight loss program that will be customized to fit your needs. All of the services within our program are offered at both locations. One thing that sets us apart from any other program is our dedication to assisting you with a lifetime of success. As I get started, I want to say congratulations on taking a very difficult first step in coming here. I know it isn't easy to talk about obesity, but we are here to support you every step of the way. Our accredited program offers top-notch surgical treatment for obesity, performed by board-certified, fellowship-trained surgeons who have dedicated their lives to helping people like you. I know there are a lot of options and treatments out there for obesity, so why choose us for your weight loss team? Because I love changing lives. Our program has had the opportunity to improve the lives of over 600 people since starting in 2015, and we are just getting started. Every team member has dedicated their career to supporting and assisting you. I would like to take a moment to talk to you about obesity. Obesity is a very complicated disease that can be hard to treat. It affects your health, your emotions, and your quality of life. There are multiple components that contribute to obesity. We don't always have the answers, such as why some ethnicities, genders, ages are more predisposed to obesity. Obesity is not simple. With surgery and a healthy lifestyle, you can fight back against the causes of obesity. BMI is a ratio of your height to weight. On the chart, height is on the left side and weight is listed at the top. There are also many BMI calculators online you can use to find your current BMI. BMI is important as insurances use this as one of the qualification criteria for bariatric surgery. Obesity is a disease that is classified based on BMI. Patients with higher BMIs have a higher predisposition for chronic diseases and excess body weight. Let's talk a little bit more about morbid obesity. Morbid obesity is obesity so severe that serious medical conditions are occurring or could occur as a direct result. People with morbid obesity could qualify for surgery. Morbid obesity is a BMI greater than 40 or greater than 35 with other health conditions such as diabetes, hypertension, and/or sleep apnea. In the United States, over 42% of the adult population suffers from obesity. Over 9.3% of Americans struggle with morbid obesity. Morbid obesity can affect nearly every system in the body. Many health conditions can develop if obesity is left untreated, like diabetes, heart disease, stroke, and cancer, such as breast cancer and colon cancer. It is important to focus on obesity as a health concern because if left untreated, obesity can double your risk of an untimely death. Sometimes, more noticeably, obesity can limit the things we love to do. Many people avoid doing activities they enjoy because of their weight. Have you noticed that you avoid going to social outings, such as the movies or amusement parks? Do you find it difficult to go for a walk or play with your kids or your grandkids? Do you feel your weight is affecting your self-esteem or leading to symptoms of depression or anxiety? If you answered yes to any of these, we can help. So we know obesity is a disease, but how do we treat it? There are multiple options. Conventional methods like modifying eating habits and behaviors, exercise, or even taking medicine can be effective. But unfortunately, for those with morbid obesity, conventional methods fail the majority of the time. The struggle is real. Many people have success losing weight, but often have difficulty keeping the weight off. Bariatric surgery can help. We also have a medically managed weight loss program that offers support for those who don't want to or may not qualify for bariatric surgery. Bariatric surgery can provide lasting results. 50% of patients maintain their weight loss 16 years after surgery. If you use bariatric surgery as a tool, follow the recommendations that we provide, and use us as a resource, there is a very high chance you'll have lifetime success. Bariatric surgery can resolve many conditions like sleep apnea, diabetes, hypertension, and improve high cholesterol and heart disease. Do you need to lose weight to improve your quality of life and overall health? You have likely made this decision already. Then how do you do it? By managing health problems and weight with conventional methods, or resolve these conditions with bariatric surgery. Most insurance companies will cover bariatric surgery based upon your current BMI and other existing health conditions. We use minimally invasive techniques, laparoscopic, or in some cases, robotic. This means using multiple small incisions, 1/2 inch or less, over the abdomen to perform the surgery. With this technique, the recovery is much easier and there is less risk involved. This means you will experience less pain, fewer infections, a shorter hospital stay, and you can return to work quicker. We offer the two most commonly performed bariatric surgeries, the sleeve gastrectomy and gastric bypass. We do not offer gastric band placement, however, we do remove gastric bands and perform revisional procedures when necessary. The sleeve gastrectomy reduces the size of the stomach by approximately 80%. You can expect 60 to 65% of your excess body weight to be lost after surgery. Typically, you will spend one night in the hospital and you will be off work for 1 to 2 weeks, depending on your job duties. The sleeve works by restricting the amount of food eaten, improving your metabolism, reducing feelings of hunger, and increasing feelings of fullness. The gastric bypass bypasses most of your stomach and the first part of your small intestine. This part of your stomach is left in as you need digestive enzymes. You can expect to lose about 75% of your excess body weight after surgery. It is usually a 1 to 2 night hospital stay, and you are typically back to work in 1 to 2 weeks, depending on job duties. The bypass works by restricting the amount of food eaten, improving your metabolism, reducing feelings of hunger, and increasing feelings of fullness. So how do you get started? Consider your first step complete. Your next step is to meet with me. Once notification is received that you have completed step 1 of watching this video, one of our team members will reach out to you to schedule your first appointment. We offer support every step of the way, whether it be through our free support groups, both virtual and in person, nutritional counseling with our dietitians, counseling with a psychologist, and continued education before and after surgery for best outcomes. What can you do today? Start working on reducing your portions and sugary drinks. Increase your body's protein intake, quit smoking, and move your body. We also recommend discussing bariatric surgery with your primary care provider if you have not yet done so. Take the next step and schedule your first appointment with an SSM Health weight management surgeon. Remember, small steps lead to great success. We will help you take it one day at a time on your weight loss journey.